To start with total arterial revascularization from cardiac perspective point of view. The mode of revascularization is only two methods. One is PCI, angioplasty, other one is coronary bypass surgery. What we expect, what patient expect from, and what as a cardiologist expect from cardiac surgeon are these 3 to 4 goals. It should be the cost effective. Whenever we do an angiogram and we sit together with a patient, he always asks these 3 questions. Being a cardiologist, we always look at these 5 to 6 questions. It should be cost effective, it should be early recovery, and most important is to relieve the symptoms with which the patient came to me, that is most likely of angina and heart failure, and most important is to improve the quality of life, and even more important is improve the expectancy of life, lifelong helpful. And last, which we will discuss about the long-term patency. So these are the few goals which, being a cardiologist, being a patient's ambassador, I think we should address these issues and would discuss these issues with the patients as well as with cardiac surgeons. So coming back to the individual goals, the cost. If I talk about the 1 or 2 years before, then definitely angioplasty was much costlier than the bypass. But because of the inflation and the change in the government and the inflation and the petrol price, I think cost has become almost same now. Because in last 2 years, the cost of bypass has increased to about 0.3 to 0.4 million rupees. If I compared the most recent third generation stents, मैं एक मिसाल देता हूँ कि जब भी अगर मैं 1 साल पहले पेशेंट से बात करता था, whenever I was talking to the patients, I always say them that, look, you have triple vessel disease, including left main, and there are 2 options, which are they. We can operate on you through a bypass, we can put a stent on them. The difference is what? Difference is between the cost. Because if I put a 4 stent over there, the cost would have been about roughly around 0.8 to 0.9 million. But at that time, if the cabbage was easily be done at about 0.5 million, the cost of 0.4 million was there. And I usually give them example that just think about you are going to Islamabad or Pindi and you opt to take the local bus where cost is cheaper, or you want to go into the luxury Mercedes. And if you choose the Mercedes, you have to pay. You have to pay the price of 4 third generation stents, which is around 0.7 to 0.8 million. But whatever current status is, there is no major difference between the cost. If I put a 3 to 4 third generation stents, angioplasty in a patient, it will cost around 0.6 to 0.7 million. And if I send him for the cabbage, definitely it will be around the same. So cost is no issue now. Now, next is definitely early recovery. Everybody knows the patient came to us for angioplasty. We add them 1.5 hours or maximum up to 2 hours or 3 hours. After them, they stand up and they walk around. No comparing between the early recovery and bypass, where we usually take about at least 2 weeks to return to the normal life. This is the only added benefit we can provide to the patients. We will definitely discuss. So, in view of cost, both are same. In view of early recovery, definitely angioplasty is more superior. So now let's see the second question. Second question is why to go for angioplasty or bypass? Does it help? और जब भी पेशेंट आते हैं आपके पास, सब कहते हैं डॉक्टर साहब चले मान गए कि हमारी इतनी डिजीज़ है, लेकिन क्या भला ये बता दें कि बगैर एंजियोप्लास्टी के बगैर बाईपास के कैन इट बी रिवर्ट बैक? डेफिनेटली नो. तो यहाँ पे डेफिनेटली आई विल लास्ट वीक जी स्टिच ट्रायल का लॉन्ग टर्म डेटा आया था, इन विच दे कंपेयर medical treatment versus PCI along with medical treatment and cabbage with medical treatment alone. So we have compared the PCI and medical treatment with medical treatment alone. Look at the randomized trials. This is PCI versus optimal medical therapy alone. The patient was selected, including, I will not go into detail of this randomized trial. I will just show the results and little bit about the study. So this was about long-term, 7 years, very, very good time, long-term effect, long-term trial, prospective trial, and sample size was around 700, which is also a very good sample size. Out of them, 50% was randomized to the PCI and 50% randomized to the optimal medical therapy. These are the results. So there is no statistically significant. Look at the p-value. There is no any p-value which is just from the back bench जो पीछे बैठे हुए हैं उनके लिए जो है अगर आप टेक्निकल हैं तो p-value significant तब होता है जब it is less than 0.000 जितना zero आएगा उतना significant होगा. So look at the p-values. There is no significant p-value difference in any of them. So that primary outcome, secondary outcome, there is no significant difference. So conclusion was of this trial for 7-year study that only PCI along with medical therapy does not have added benefit in the mortality and morbidity. But yes, it has apparently better effects on the quality of life. So if we talk about the quality of life, yes, PCI will definitely improve the quality of life, but it will not add benefit on the mortality and morbidity. So if you're coming back to the goals, I will show you this slide frequently, very frequently, because when we talk about our patient, when we talk about my patient, I will definitely answer these 3 questions, these 5 to 6 questions. So in PCI, definitely now cost is not an issue. So early recovery, PCI is favorable. Relief of symptoms, PCI favorable. Improves in life quality, definitely PCI, there is an improvement in life. But the last 2 questions is still answerable. It's still questionable that does PCI improve the life expectancy? Does PCI is long lasting? We will answer in a couple of minutes. So this is another trial which include the bypass with medical therapy or medical therapy alone. This is also the sub-part of the STISH trial which has just published about 10 to 15 days back. So look at this result. Bypass has significantly reduced all-cause mortality. Sorry. Bypass has significantly reduced the all-cause mortality and cardiovascular mortality with significant p-value. Look at the all-cause death and revascularization. In the last, there is a less than 0.001%. So definitely, bypass has improved the EF, improved the life expectancy, and improved the quality of life. But the early recovery definitely remains the hazardous in the bypass. So we have to answer the 5 questions, and with regards to the bypass, relief of symptoms, yes. Improvement in quality of life, yes. Improvement in life expectancy, again, yes. But now the question remains that what about the long-term patency? Does PCI or bypass both have same long-term patency, or bypass is somewhat superior? Let's have a comparison, head-to-head comparison with PCI, especially in patients in home. Bypass is class 1 indication in patient with left main disease. So I have brought some of the meta-analysis from different areas of the world. This is from the Seoul, other is from the European countries. This all data is from 3rd generation stent, most latest stent, because latest stents are being well formulated, well accepted, well modified, along with the drugs have improved outcome. So let's see what the result says. This says that definitely 5-year survival is with PCI and cabbage is same. So 5 years was moderate improvement in the long-term patency. But if we see the Lima, it gave a patency rate of more than 15 years. So in comparing with the Lima, definitely PCI and left main, still we have lack of definitely evidence. So we have now currently more reports data up to the 5 years that left main stenting, definitely stenting have a 5 years rate is more than venous graft. So this shows that although patency rate is very good at 5 years, but repeat revascularization in PCI group is more frequently than the cabbage group. This is another meta-analysis from the European and this from the 3 trials, which are Noble, Excel, and main companion trial. Results are almost same, that there is no difference between the morbidity and mortality between the 2 groups in the left main stenting versus cabbage. However, definitely the revascularization rate in left PCI group is significantly higher than the bypass group. So let's have a look at the conventional cabbage patency rate. What the data says. Look at this. If we compare the conventional cabbage group with Lima, so after the 5 years, the rate of occlusion of the venous graft has significantly decreased. So up to the 10 years, Lima has 82 patency, as already discussed in detail, patency of Lima. And if we put a venous graft, definitely if a surgeon goes for the venous graft and a patient comes to me that what are the patency rate between between the venous graft and the stenting, I will definitely say that we have plenty of data that stenting versus venous graft has almost same patency rate up to the 5 years, almost. Definitely if we go little bit detail in the coming slides that what we see, what happens with the arterial grafts. So look at this. This is the meta-analysis. Almost 80% of the venous graft occluded, 7 to 20%. Definitely, this is a little bit older advice. Many of the cardiac surgeons will not agree with me that the technology now has become more and more. The patency rate and the grafting rate techniques have improved, so that could be the more than 70%, less than 70%. But this meta-analysis said that SVG at 5 years, usually 70% of the graft occludes. So again, coming back to the goal. Up to now, we can say that up to the 5 years, all answer apart from improves life expectancy, cabbage is definitely as comparable with PCI. What happens? Because we are living in a very diverse country where economical issues are very much important. अगर मैं पेशेंट को अपने को कहूँ कि यार मुझे हर 4 साल या 5 साल के बाद मुझे स्टेंटिंग करनी पड़ेगी, डेफिनेटली पेशेंट मैं भी बीइंग अ कार्डियोलॉजिस्ट सोचूंगा, रिपीट सोचूंगा, और पेशेंट अपार्ट फ्रॉम, क्योंकि अगर मैं सिंगल स्टेंट भी करूंगा इट विल कॉस्ट अबाउट 0.3 to 4 मिलियंस. तो जब मैं 3 साल या 2 साल या 3 साल के बाद मैं रिपीट रिवेस्कुलेशन करूंगा तो डेफिनेटली द पेशेंट हैज़ टू पे फॉर दैट. सो द लॉन्ग टर्म patency. Let's see what cabbage offers in the. So if we coming back to the SVG has not that much patency at 5 years. So we need something more conduits which can give us more patency rate beyond the 10 years or at least 10 years rate. What are the other conduits? Look at this. These are the arterial conduits which shows more than 90% arterial conduits at 5-year patency rate. It is Lita, Rita, radial artery, as my senior colleagues and my cardiac surgeons have already discussed about. In this as well, at 5 years, SVG has least patency rate at the 5 years. And this is the data shows that if we put a 2 Rita and Lita, and look at the patency rate up to the 12 years, more than 70% patency rate. There are more than 70% patency rate at the 12 years if we put a bilateral Lima grafts. So, and this is the meta-analysis which shows that the bilateral Lita and Lima grafts shows in all the articles, there are about 20 articles. Every article shows that everything is better with a bilateral Lima graft rather than single Lima graft. This is also with a long-term patency rate with a bilateral Lima graft. Every sees that the group which is showing that the bilateral Lima graft always is favorable than single Lima graft. And same is with if we compare with the radial graft with the venous graft, definitely radial graft showing significantly improved patency, significantly improved survival rate, significantly less complications than the venous graft. Look at the chart, everything is in favor of the radial graft. So putting all together, in my environment where cost is a major issue, revascularization major issue, if I got a luxury of total arterial graft, definitely my 6th question will be solved. If a patient come to me, ask me, sir, definitely, I don't think so. You are not familiar with this question. सारे patient जब आते हैं कि sir, bypass आप करा तो रहे हैं, लेकिन इसकी life कितनी होगी? I think whenever I refer patient for angioplasty or bypass, everybody asks me about this question. So if I say them that, okay, I'm sending towards some surgeon who is fond of putting a total arterial graft, I can confidently say that आपके 15 साल तो गुजर ही जाएंगे. तो roughly around हम जो देखें हमारी एज में bypass होने में, if we keep on 55 या 60 years पे जो हम bypass के लिए भेजें पेशेंट को और उनकी 15 साल तक पेटेंसी गुजरेगी, तो 75 years की हमारी तकरीबन roughly around life expectancy नहीं है. तो इन पेशेंट्स में definitely we will not have a chance of revascularization, reoperation, re-angioplasty until जिस कभी अगर कोई स्पाज्म हो गया तो अलग बात है, नहीं तो फिर डेफिनेटली कोई चांस नहीं होगा. ठीक है, तो विथ टोटल आर्टेरियल रिवास्कुलाइजेशन I can answer all these questions. It is a cost effective. Apart from early recovery, it always relieves symptoms, improves quality of life, improves life expectancy, and as well as long-term patency. So we are looking, being a cardiologist, being a representative of cardiac point of view, I would love to have total arterial revascularization rather than conventional bypass surgery. So in conclusion, the superiority of arterial grafting over vein graft may well lead to the shift in the way we manage the coronary disease, because we always pull together. Cardiologist says patient is mine, cardiac surgeon says patient is mine, and in last 10 years there is always debate. So if I have got a arterial graft, then definitely revascularization and long-term patency, you people must have superiority over the PCI. And if survival curves following vein graft, as we already seen that and stenting overlaps, almost same result at 5 years, then it will be difficult to continue advocate a revascularization strategy comprising largely on the left graft, vein graft. Thank you.